than the three of us?
We do. We have 17 people online.
There we go. Okay, great. Oh, now I see it. Hi, good morning, y'all. This is Bill calling from beautiful downtown Las Vegas, Nevada. And we're talking today, our main topic today is on HIPAA and HIPAA high tech. And this is going to be a bit of a different presentation because I'm actually going to go to the Office of Civil Rights, which is the agency that's responsible for doing the HIPAA and HIPAA high tech. And one of the things about them is that I just read last evening as they're preparing for this is that this section of the HHS, Health and Human Services, has an $83 million budget, and $44 million of it has been turned over to the Office of Civil Rights, and that's up $5 million from the year before and up almost $20 million from the year before that. So we do know that the OCR is taking this very seriously and going to be coming back and doing much more work. We have these slides. I put them up all the time, and for the syllabuses, we're doing the data integrity today, which is the HIPAA, and then we're going to be doing the financial relationships as we're actually getting the attorney who works for the LPCAs, who's on retainer by the LPCA, or one of the members of his staff, because we want to make sure that Fraud and Abuse and False Claims Act and so forth are taught by attorneys. So this right now will be the last time you will hear my voice until we decide we're going to do something different. But we will be on with those two. Main thing we're looking at today is HIPAA and HIPAA high tech. And the first place that everyone gets stuck and stopped is on this next slide. We all talk about protective health information, PHI, protected health information. And every time somebody asks me what is protected health information, I have to sit and start counting on my fingers. And there's 18 of them. And what these 18 are, and this is where there was some confusion in before, is that you should have no two of them on the same piece of paper at the same time if you're trying to transmit HPI. So for example, we're going to just run through these, and then I'll give you some examples of things that I'm finding, and I'm finding on a daily basis, and every time I go in some places that I ask the same questions and they're still giving me the same thing. Names, the patient's name. And when HIPAA first came out and everybody saw the name thing, is that I was down in Miami and Naples and down in Florida, and we had a number of physicians who went running out and bought the deli ticket machines, little red machines, and you pull a ticket out, and then they would come out and scream number 47 and so forth and so on. And they said, because HIPAA said we can't use the patient's name. Now, you can use the patient's name in the waiting room, but you can't disclose anything else. And one of my jokes is to call my name Bill Carberry, how are you? It's fine. Bill Carberry, how are those hemorrhoids doing? That's wrong. That's just wrong, wrong, wrong. But it's wrong both on a HIPAA standpoint because you've given a diagnosis and you've also used my name. There's also a lot of discussions about whether or not you can use, if I'm sitting in a cancer clinic, is that, well, don't they know that I'm here for cancer? And, well, yeah, they do, but that's an inference on someone's part that is not you all exposing or disclosing any of that information. So we're just going to run through these things. Number two, I've read that and read that and read that and read that and read that. I have absolutely no clue what it means, particularly the last half. I do know what the first part means, which is the zip code, and then I do understand with the combining of all zip codes with the same three initial digits, but that last one and the initial 3 digits of a zip code for all such geographic unit containing 20,000 or fewer people is changed to 000. I don't know what that means, but just for our purposes, let's just say the first 3 digits of a zip code. Dates other than the year directly related to an individual. Generally, you're looking at that as a birth date, and I know that in most practices, or yours is the first thing to look people up is I need to have your birth date. So I know we collect that information. Phone numbers, fax numbers, email addresses, the next Social Security numbers, medical records numbers, health insurance account numbers, certificates and license numbers, vehicle identification numbers, device identifiers and serial numbers, URLs, internet protocols, biometric identifiers including finger, retina, or voice prints, full face photographic images, any comparable images, or any other unique identifying number, characteristic, or code except the unique code assigned by the investigator to code the data. Now, let's talk about what that means in practicality. We have the sign-in sheets, and most everyone, I'm sure that in your places that people come in and they sign in. And the fact that they sign in, and I watch everybody dutifully, they either have the peel-offs and they put the peel off and they'll put that someplace, or they throw it away, or they take a big black magic marker and they screen through it. A sign-in sheet with a patient's name on it is protected health information, but is not a violation of HIPAA because you only have one piece of information. Now, I have seen people who have modified those and went in and they took a sign-in sheet and they told them to put their name and their birth date on. Well, the minute they put their name and their birth date and it's just laying up on the countertop, is that now I have two pieces of information, and basically you do, according to, have a HIPAA breach. And I see that quite frequently, and I'm not telling you stop doing that, stop doing, stop using the peel off, stop using the black magic marker. It's just the name by itself is not an issue. It's the name with another piece of information of any one of these pieces of information. So the name plus any one of these, whether it's the birth date, phone number, email address, any of this stuff, then that becomes that now you're falling under that you are releasing PHI without the patient's knowledge. And so you do have a breach on that. The second place that I see this happening in offices, is despite that we have electronic whatevers, is that every morning someone prints a doctor's schedule and lays it on the countertop. And where I am right now is I go around and every day I take those things and turn them over because they have the patient's name, their medical record number, their social security number, their birth date, and their phone numbers, and their fax numbers, if they have them, all on the same piece of paper and just laying right there where anyone who walks up to that desk can read those. And so that's the second place where I see those two things, is that I always see them just laying out and people doing that. Just make sure that if you do have those schedules, is that what I've recommended is you just take, get a clipboard and you put a clean piece of paper over the top. So all you have to do is lift it up and you can see all the information because you do have it. You have made it where it is not easily visible. The third thing that I keep seeing people do is if a physician or you all are working out of different clinics. And what we're doing is that we will take a medical record, sometimes a paper medical record, or we take a list and so forth, and we just simply throw it in the back of the car and off we go. The way that you're supposed to transport that stuff is in something, So if it's just a single piece of paper with the patient's name on it, is if you put it in an envelope and then you put it in your zip-up purse or your zip-up backpack or your clasp briefcase, you're not violating any HIPAA regulations. So it's in something, both of which are sealed. If you're transporting the records, we recommend that you put the records in some sort of valise, and then you can put it in something else. A lot of folks, you can just go to an Office Max or a Home Depot or one of those things, and you can buy those little record folders that you can that you put them, and then they have a lock on. Put that in the trunk of the car, and so you put your records in something inside that in the trunk of the car. So now you are fully covered with that. The reason for this is when HIPAA first came out is people were disposing of medical records, and a garbage truck picked up one of the old green bars. For those of you all who are old enough to know what the green bar print looked like, it was a clinic, and every patient's name was on it. It was about 2,000 pages long. Well, as the garbage truck was streaming down the road, it was streaming these things behind it. Somebody picked those up and then put the information up for sale. So what you want to be able to do is say that we put it in something in the trunk of the car, we're good. in the event of an accident or anything, is that that paper is not just going to get strewed out all over the streets. So that's why we do that. And I don't know if the rest of you all have that issue of, you know, what is PHI. I had a very astute attorney send me a, who knows all about this stuff, send me an email, and in the email was a spreadsheet that had everybody's name on it, and with their date of birth and so forth and so on for records he wanted me to review. And I called him and I said, you do realize you just sent this to me this way? And he said, well, I protected the worksheet. Well, protecting a worksheet, which is all of the little things that you have on the top of the Excel, is not where you protect the worksheet. Is that when you go over to print it, or you go over to save it, is that then you have your security and you have to issue a, you have to put your own password in there. And so what we generally do is we will send the password protected, not secured, a password protected, not protected sheet. A protected sheet just simply means you can't change anything on it. But a password protected means you can send it, and then in a separate email, send the password. Never, ever lose the password to that worksheet, because Excel can't open it, nobody else can open it. If we lose the password, it is a worksheet that no one will ever be able to see. But think about that when you're sending information. I did a review at one doctor's office and said that they were having trouble faxing their information over to Blue Cross, and they just went ahead and finally they said, we just sent it to the Blue Cross lady by her email. And I said, what did you send? She said, oh, the entire medical record. Was it password protected? No, it was secure because I had to put my password in order to open my computer. So let's understand what secure emails mean. Is if you don't have a secure email and you're sending information, the best way to do it is what I just said, if you can password protect the file, or you go ahead and purchase it. And I believe that Norton and McAfee and Kaspersky and probably Windows, all of these guys do have a password protected. The place where I see it happening the most is in the back shop, where we get information from the billing company or we're transmitting information to the billing company. And so that is just one of the places that I would just recommend just going through and looking and saying, how do we transmit? And if you're doing it through a file transfer protocol, that's generally secure. So someone said we just FTP it, and FTP simply means file call, because that's over a secure setting and everything is fine. But be very careful when you're sending emails. Now, one of the questions that I get frequently is patients send us this information. Now what do we do? They send it to you by email. The fact that they send it doesn't mean that you have a breach. If you do something with it to send it to someone else, then you have a breach. You can caution them not to do that. Tell them it's the same as talking to a Nigerian prince, is that they should not be sending that information across an email. If you're using a patient portal that is a secured messaging line, and you can go back to them. If you don't have secured messaging on your patient portal, then frequently people say, oh, just send me the list. And again, most of the times where I see this happening is I see it happening with, you're trying to, probably not in your setting as much as other settings, is the doctor is going to go make rounds at a nursing home, going to go make rounds at a hospital, and he says, email me, fax me, text me, or said, email me or text me the patients I'm supposed to see. Sending a patient's name is okay. Sending a patient's name and the room number, sending a patient's name and a birth date, sending a patient's name and a social security number, that's not good. But sending a patient name is not a problem. But this is where I see it the most. And then the final place where I see a lot of opportunity for there to be lost is that we keep a lot of information on our cell phones, our mobile phones. We're way past PDAs, but we used to have PDAs. We're way past those. Is that is that those things, if they're lost and they have patient information on them, that is considered a breach. And I'm sure that you've all heard the story of the people in New York who left the hospital with the laptop, which was unsecured laptop, and they lost it. And there's somewhere between 30 and 40,000 pieces of information out there that no one's found. They haven't done anything with it. So just be mindful that these are the 18 identifiers. Just be mindful of the fact that that these are the things that need to be protected, and this is the protected health information. Now, my next slide actually starts with these three websites, or these three URLs. I'm actually going to go there. As I was telling Christine, as I was putting this thing together, I started looking at this, and I was using the Office of Civil Rights as my documentation and my training guides and all of that stuff. And then halfway through doing all of this, as I realized, wait a minute, this is their training manual. This is their information. This is what they want us to know. So I thought two things. One, I'm going to show you how to get there, and two, and then we're going to use the rest of the time to actually go through their training process. Now, what it does for me is that it helps you all understand where that resource is and what's available to you, and then you get the latest training, because the stuff that I learned in 1992 is not valid anymore. The stuff that I learned in 2001 may or may not be valid. So I wanted to just bring you these websites. Now, in the packet that was sent to you all, we have enclosed a lot of the information that we're going to talk about, we're going to look at, but I want to show you where you can get it. And when you go to the first place is the Office of Civil Rights. So if you give me half a second here, I'm going to this little rascal, and I'm going to go right here to the Office of Civil Rights. And when you go to the Office of Civil Rights, this is not the first page. Let's go back to the first page. This is the first page for the OCR, and that's that first URL that we looked at, the OCR index HTML that we had before. And then the first thing you want to do is you just look at the health information privacy. And what's really funny is that they've made this for OCR for dummies, because it says contact the Office of Civil Rights, non-discrimination, and then the health information privacy, and it goes to the same, they all go to the same place. Then you have two things. One is the HIPAA for individuals, and one is HIPAA for professionals. And we generally use the HIPAA for professionals, but the HIPAA for individuals is what they are telling they're telling folks that you should be doing. So it wouldn't hurt to simply go through this and to look and see what they're looking at, your rights, the HIPAA, other languages, so that if you do need to go into another language for some of these, is that you have folks who speak a different language than what you do. Here is some of the information, and it is in the different languages, and you can go, so you can give them the information. And this is where you can see all the things that you're supposed to be doing for your folks. It's their right to their medical records, and it tells you what we're supposed to say. Employers' health information. So it helps you all notice what's going on. And then the notice of private practices is, this tells what you're supposed to sign. But here's the thing that I like about this, is that the document that you're getting signed for, that you're getting people to sign for HIPAA, they have them all right here, and they're all in different languages. If you have them, I know that where I live in Orlando is that just outside of Orlando, is about 80% of the people that live there are Spanish speaking, and so it becomes a very good sign for you to have. Then you know that you're the most up to date, which is why I want you to use this website, because it has the most recent one. And whether they have updated what you have or haven't updated, is I generally look at the first of the years, going through and just looking and making sure that I print new ones. and then you can have it available. Okay? Questions?
There is one question from a few moments ago. What about in specialty care centers, for example, ASOs, where all patients have the same diagnosis, for example, HIV?
Right. Again, is that they're coming into your clinic and that's what you do, but we could safely say not everybody that comes into that clinic has the diagnosis, because they could be a significant other and so forth and so on. So the fact that you are a specialty clinic, whether it's a breast center, whether it's dermatology, whether it's a cancer center, or HIV or anything else, is that you're not telling people that the people sitting in the room have that. You may use their names. Now, if you don't want to use their names because you really, really, really think that that's not a good thing to do, then don't. You're not prohibited from. Okay, but if you all, because of sensitivity in that clinic, don't want to use people's names, then by all means, that's up to you. You're not prohibited from doing that. Make sense? So I'll go with your feelings on those things more than I would the law. So we always talk about you must do, you should do, and you ought to do. Well, this may fall under an ought to do, which is a moral obligation, not a legal obligation. And morally, you may say, I really don't want to do that. Back in the old days when we actually had clinics for unwed mothers and so forth and so on, is that we didn't really use names just to protect the innocent. But you're never going to stop someone from recognizing someone who is in there. And if they know each other, you're not going to stop that. So you're not prohibited, but I can see where ought to would be a good thing. Is that fair enough? Whoever asked that question, I didn't see that question. Do I have the question? Yeah. All right. Cool. All right, now we went over to the HIPAA for professionals, and just walk you through here for a couple of things. Here's the final privacy rule for 2000, and then you see compliance with the privacy rules required as of 2003, and then 14 for smaller health plans and so forth. Walk through this and find out all the stuff that you need, but I like this thing right here, training and resources. There's a number of things other training and resources, and I think that we have provided you with the guide for privacy. There's a guide for providers, but this one does have a login retirement. These are videos and stats for the 2011 where they trained the state's attorneys general. And by the way, they did this correctly because it is state attorneys general, not state's attorney general. And then computer-based state attorney training modules, and you can do those, and then you can sign up to get information. I went here to the guide for, yes ma'am?
I'm sorry to interrupt you. If you are still on an internet screen, I can no longer see that. I only see the cover Corporate Compliance Institute series screen up.
I've changed screens a couple of times.
Okay.
Let me do a refresh and see what happens. Let me see where's share my screen. Share my screen. The clean hides all the icons.
Okay, you're back up.
I'm back. Okay, and we're the guide to the privacy and information.
Yes.
Okay. And where I was, maybe it just took a little bit of time. Training materials. Did you go back to training materials? I think we may just have a lag.
You're on training materials.
You're on training materials, and what I did was I went right here to the middle where it says Guide to Privacy and Security, and that is the third URL that you've got on your slideshow. Okay, and so I'm going to press that. We'll wait a couple of seconds, and we should get the rest of it. And I'm going to assume that it did come up.
You're on the Guide to Privacy and Security.
Guide to Privacy, perfect, perfect. And this right here, this gray bar in the middle, if you all can see my little moving around here, is it gives you all the HIPAA basics, and then it tells you where to look. And when you're looking at this as Chapter 2, we'll just hang on to that for a second because we'll show you. And then this notice of privacies, and it tells you that's in Chapter 3. And it just gives you a very quick overview that you can share. Now, this is what I was going to do, and then I realized is that, to do this, and then I realized, hold on a second, I'm actually just showing them what the guide is, and why not let's just show you how to use the guide. Now, one of the things that they put on their thing is this disclaimer down at the bottom. It's not intended to serve as legal advice or as recommendations based on a provider or profession's special circumstances. Getting us back to the HIV thing, we encourage providers to seek their expert advice when evaluating the use of the guide. That's their disclaimer. However, is that if you do things according to the guide, is that you're well within the law, but you may modify it. You can't loosen it, but you can make it stronger. So, for example, in the HIV clinic, if you say, we're not going to call people's names, we're not going to put in a sign-in sheet, we're not going to do that, you don't have to. You're okay with that. But this then is just the guideline. Now, simply download the guideline, and it comes out with this thing is absolutely wonderful, because with the bookmarks, if you all know how to use the bookmarks, you can just simply go through, click on what you want, and get to it. Or with this, they had did the electronic guide come up? Have you got the guide to privacy and security up yet?
Yes, thank you.
Okay. I can see what I can see. I can't see what you see. And here's the thing that I like the most about these is that you see this was updated as April 2015. So it is the most recent one that they have. But keep checking to see whether or not in 16 or 17 is that they actually change it. Great table of contents, because it goes to why do privacy and security matter, and so forth and so on. And then this was the Chapter 2 that they reference, your practice and HIPAA rules, understanding responsibilities, what type of information does HIPAA protect, and then this gives you the very brief definition of it, and then who must comply. So for me is that it's a very simple guide, a very user-friendly guide. Whoops, I wanted to go home and I wound up going all the way back. It just winds up doing this rather simply, and the more that you can see this guide. Now, I actually printed mine because it's only 62 pages long, which I would, you can print and put in your compliance guidelines and go through. Here, this Chapter 3 is that it gives you understanding the patient's information, and then using electronic health records and what you have to do there. EHR, the meaningful use, great. And then this Chapter 6 which is where I was going to spend a lot more of the time, because what it is that they had what they call a 7-step approach, but the first thing you're going to find out is the 7-step approach gets a little longer, because the first thing they did in step number 1 is they did the nice step number 1 right here, and they said step number 1, and then they have this stuff. Then they have 6 actions under step number 1. So we don't just have 7 steps. So now we got 14. So, but 13. I did 7 and 7, not 7 and 3. But this goes through and says this is what your designated security officer, and it tells you what they're responsible for, and then it gives you the things that you should be doing when you do the designation. Discuss the HIPAA security requirements for EHR developer. Now, most developers are HIPAA compliant, and they will tell you they're HIPAA compliant. So it's not even, it's generally, you just need to ask the question once, is are you HIPAA compliant? And if you go to purchase something, you just need to make sure that it is HIPAA compliant. And then we go to 1C, which is the using qualified professional to assist with your security risk. And what they're talking about there is to going out and getting, you're supposed to be doing a stress test, is seeing if someone can actually get in your system. And we have a couple of folks we have worked with. One of them is one of them is in Biloxi, Mississippi, and the other one is in out of Orlando, Florida, and they can do those stress tests. And you have to pay them, but they go in and they actually pound the system and see if they can break it and get in. And then they make recommendations of what can do to tighten it up. Use tools to preview your risk. This is what they're doing, is to try and get through to get a preliminary shortcomings of how to break into your system. And we do know that the systems can be broken into, because if you watch the news for 37 seconds, you know that WikiLeaks, Wikipedia, and so forth, and they are doing this every day, or the Russians or the Chinese, or they took down the whole East Coast and the websites over the last Monday or Tuesday. So it's just, it's just something we need to know. Step E, refresh your knowledge of it, promote the culture. And when they're talking about the culture, and we keep talking about that, is that we want a culture of compliance, is that we want people to understand. We want them to do it correctly. We want to do them right. We want it right the first time. We don't want people doing it the wrong way. And the reason that people are generally doing it the wrong way is they haven't been taught that there is a different way, or there is a right way. So that is the promotion of the privacy. And it's just as an example, now I walk by the desk where one of these is, and every time I walk by is one of the MAs slowly picks it up and turns it over. So I know that I haven't been able to change the behavior yet, but they're at least thinking that their behavior is not correct. Then again is documenting your findings, which is you always need to do with that. And then this blue box over here gives you the records that you should retain. Training materials, you're supposed to do HIPAA training annually. We're supposed to be doing a security risk report annually. You're supposed to update your BA agreements. That, just making sure that they're the latest things. And oh, by the way, in this document, I believe is that we have samples of business associate agreements. And I always, when people ask me which one, do you have one that you like? And I say, yeah, I have the one that's generally done by it's not here, it's on the other page. They have sample business associate agreements. So if I went back to, if I go back to that page, I'll show you where that is. So I always like to use what they recommend. It has to be modified for your circumstance, but I always like to use what they like, because if they like it and they come in and they see it and they ask you where you got it from and you said it and they go, okay, fine. Generally it's finished. The SRA tool is really, really, really good, this SRA tool, where you can do a self-evaluation of your EHR and your security system. It's really good. It doesn't take long to do it. It's very intuitive. I've used it in a number of different occasions, and it works beautifully. And what I generally recommend you do is, if you're going to be doing this, is do the SRA tool first, get your results, and then if you need to hire someone to come in from outside to look at your systems to make sure that they're secure, you've at least already, you can lead them to where you really think they need, instead of it just being an open-ended contract. Okay. Questions? Anything from here?
No, not at this time, thanks.
Right, okay. Gonna go through and do the next one. The internet hosted EHRs versus office space, is that the main thing that I see in places where you have office space is that we did one of these analyses, and we looked at all the different places that they were, and in every one of them is their server room was unsecured. It was open, because they said, well, it gets too hot in there if we don't. So the server room door is left open all day long and all night long, so it is never really secure. Cloud-based or internet host EHRs, those are more secure. You just need to make sure that they do a backup for you every evening, and then that somewhere along the line they do test the machine to make it their system to make sure that it is still HIPAA compliant and people can't bang on it. Okay. Going to go to these are, and again, as I started to do this thing, as I ran across this, I said, man, this is just wonderful. This is great. And I'm sitting here going, okay, here's some really things that you can look at. Natural disasters. Now, y'all do live in Louisiana, and I think that Louisiana is about, at some point somebody told me that 90% of all the bridges in the United States are in the state of Louisiana. And I don't know if that's by miles or by number. But you all go through national disasters all the time. Always store routine backups off-site. Generally do those daily in the evening, see whether or not they are. The same thing is regarding follow the best practices, is making sure that they're password controlled. People are not using each other's passwords, that you're able to track what people are doing and so forth. Office-based EHRs, just keep going. Cloud-hosted or cloud-based confirmed that follows U.S. security standards and requirements. And these are just simply questions that you ask them. Do you have it? Record their answer. Record their answer and then put it in your compliance. Well, yes, we have done that. I've always asked all of these companies when they're cloud-based. I've always asked them, where are their servers? Servers that are based outside of the United States are not necessarily under the laws and social values and mores of the United States. So I'm very skeptical of companies that that my data information is being stored on a system which is not in the continental United States. That's just me. Now, let me give you the horror story, is that a physician group had a billing company, and they paid the billing company. The billing company was a United States company, but the billing company then outsourced all of their information to India. And just as an example is that the billing company was being paid 50 cents a chart or 50 cents for every bill that they sent out. They were paying in India 15 cents. Well, the administrator of the clinic got a phone call from India and said, we have all of your data. If you don't start paying us 25 cents, we're going to release it. So just that is a true horror story. That is anecdotal. It did happen. And so just confirm where you're, if you're cloud-based, where they are. I'm just very, I'm very leery of anything that is not stored in the United States, because the minute you leave the United States, the rules change. Now, if it's in Great Britain or Ireland, I think their internet rules and regulations are even more strict than ours. But when you go to Russia or to the Balkans or something like that, it is the Wild West. They don't have as much, as many or as much rules as we. So there we go. Develop your action plan once you find out what you're doing, what you've done through using this analysis machine, this little analysis device here, the SRA tool. Once you've done the SRA tool, it'll point you to things that need to be done, and then you just create the action plan of how you want to do it, where you want to do it, and develop the action plan, and then just try and follow it as best you can over the days. And then they're so great to tell you what the 5 components are, and then here is, say no to staff requests to take home laptops containing unencrypted EPHI, remove hard drives from old computers. One of the things that we forget about, and we've just been through it here where I am, is that we replaced a lot of our Xerox machines, or our copying machines, and you have the copying machines now that are that are both copy machines as well as scanners and fax machines and so forth, is that when you go to replace those, is make sure that the memory card on those has been wiped clean, because we have seen folks who've gone into printers, even the small printers like you have on your desk. There may be a hard drive memory or a flash drive memory on it that has all the documents that you've done. So just make sure that you get that out. Where I am right now is that one of the questions that I keep asking is, we have the shred-it boxes. I'm sure that you all have those things. And when I got here, everybody had a key to one. And I mean, there were like 5 or 6 people. And I asked the question, why do you have keys? They said, in case we need to get in. And I said, aren't you defeating the purpose of that? So if you have shred-it boxes or shredding machines or things, is that treat them like it would be a shredder. Once you drop it in, it's gone. And limit the number of keys that you have, or the number of people who can, that you can do. Here was the thing, is make sure your server room is accessible only to authorized staff. The passwords. So these are some of the things that I've just talked about, and they're all right here. Maintain a working fire extinguisher, which I think is interesting in case of a fire, and then check your EH4 viruses and malware. And here are security components for risk management. Again, I'm not going to read these, but there are all the things that we've just been talking about. Business agreements have not been updated for several years. Conduct regular reviews. I like to look at them annually. What I do is I look to see if there is a new VA agreement on this website that people are recommending, and then I have it compared to what we have to see if there's something new in the VA agreement. And with the new interpretation of the exclusions lists, is that your business associate agreement or your contract, somewhere in there should have something about that, and that's been new, that they've been hitting it hard for the past year or so. So you may have an old BA agreement or an old service agreement that doesn't contain that language, and you probably just need to see if it's up there. Like I said, y'all can read these things that really just get you familiar with this website. Keys to the practice. And when you're talking about keys, you're talking about virtual keys as well as the other. As we all know, I'm sure you all know what the #1 password is. Password. The #2 password is 123456. They caught Apple or Microsoft, one of the two, just a year or so ago, is they went into a system and there was a file folder that said passwords, and they opened it up and it had everybody's password for everything in that one folder. So keep your passwords protected. Change them periodically. If someone leaves, is that it's not a bad idea to change everybody's password. If you have an IT group come in, and they need to make sure that they disengage their passwords and so forth. All right, and then we're going to just go through these things, implement them. Again, they said there's only 6, but then you wind up with 5A, 5B, 5C, and you go through. We've got about 15 minutes left, and I wanted to get through the breach portion, which is the Chapter 7. I wanted to just go through what you're supposed to do on a breach. And the first thing you need to do if you suspect a breach is contact your attorney, and let the attorney handle the breach notification, because it's a dicey little thing when you handle the breach, because you wind up having to put things in newspaper and send patients letters, and so forth. And I want to just get to 7. I think it's 7. Nope, that's step 7. And I want to get to Chapter 7. There we go, Chapter 7. The breach notifications. Get your attorney involved if there's a breach, because if there's a breach, then there are certain steps that you have to do. You have to, again, you have to notify the patients of a potential breach. You have to notify the OCR of the breach. You may have to put things in newspapers, and it's a very stylized as well as a programmed what you're supposed to do. But if you get your attorney involved, it'll probably be a whole lot easier. And then this is the thing that I said I was never going to talk about, which is the criminal penalties, because it's just there are criminal penalties, but it is the knowing misuse and the knowing are unpermitted. Now, I have had experience with one of those in an emergency room. One of the local attorney groups came in and paid out one of our emergency room ward clerks or unit clerks. Every time an automobile accident came in, they paid him $50 for every face sheet that he faxed over to them. And when we caught him, he said, I didn't know I couldn't do that. Oops. So we then had to go through a whole big process of that. And we had to go through a whole big process of, because we had to go back and to see who and how many, and we had to do notifications, and it was horrible to try and do that. So when you look at this whole process, is that it's how you need to do it, what you need to do. Low probability of compromise, PHI, is no notification. The probability of a compromise is notification is required. I'm not going to tell you what, that if you send one email to Blue Cross with patient information on it, and it's the only time you've ever done it, I'm not going to tell you, because I am not a legal person. I'm like you all. I have other degrees, but none of them are a law degree. But if you have something like that and you're concerned about it, I would contact your attorney and just see what you want to do and how you want to do it. And then as you can see right here, there's a whole website on how you do breaches and what you do with breaches, and then how it's done and so forth. But breaches that affect 500 or more individuals, and then affecting fewer. So you just, if you have a concern, I would ask my attorney and say, we think we have this breach. Is this a reportable breach? And let them direct you. Don't let Bill Carberry direct you, because he'll probably steer you wrong. I don't trust him. So, and then here are the fines. Is did not know or could have known is that it's $1,000 to $50,000. Reasonable cause but not willful neglect, up to 50. Willful neglect within 30 days, 50 not corrected in 30 days. So there are civil penalties. Don't want to scare you with those. Just want to make sure that you all are aware that those things are out there. And this right here is a great website for you to look at if you have questions and to go through. I think if I've got my timing right, we've got about 8 minutes left. I want to see if anybody has any questions, any things to clarify. This is different than what I normally do, because I normally would have all of the slides here, but we have provided you with this information. We've also the handouts that were provided are one of them is this guide right here, and then we've also just provided chapter 6 and I think chapter 7 for you all, so that you wouldn't have to go. But for me is that this showing you where to find the information makes you an expert. You can go in and look at it at your leisure, see if there's anything that scares you about your organization, and we just go from there. Okay. Anything else, or do we have questions, or anything on any other question, any other topic that we had covered in the past?
There have not been any other submitted questions, Bill. We could take a moment to go ahead and allow you just a minute or so if you do have a question, as Bill had mentioned, you could ask anything about this particular topic or any of the past ones. And while we're waiting to see if any additional questions are coming in, I did want to go back to the last session of the Institute that we have planned for will be on financial relationships, where we hope to cover some fraud and abuse, False Claims Act, and Stark laws during that one. We are trying to confirm a date for that, and my guess is that if we have it in November, that it will probably be mid-November versus the end, because the holiday season then with Thanksgiving starts towards the end of November. So, but we will try to get that one in prior to the end of the year. All of our sessions have been recorded and are available on the LPC website under trainings. And all of the handouts and presentation slides that have been provided during these sessions are also available. If you can't find them on the website, then feel free to email me at cforstner@lpca.net, and we'll be sure to get those out to you. So I still don't see any questions. I'm going to go ahead and thank you, Bill, for the entire series of presentations that you've performed for LPCA and its members. And we hope that for those of you who would like to follow up on anything specific for your health centers, that you will feel free to reach out to Bill and Peak Performance Physicians at the email or phone number that Bill's provided for his presentation. So thank you once again for joining us for the series, and everyone have a good afternoon.
Thanks, Christine. I've enjoyed it very much.
Good. Thanks again. Goodbye.
Bye.